Doctor, once we do figure out that someone's suffering from allergies, how can we treat them? A lot of different ways, I know, so tell us about that.
Absolutely, and we try to tailor the treatment actually to what the most worrisome symptoms are or bothersome symptoms are. So there's lots of different medications we can use. If you have more eye symptoms, we might go more with eye drops. If you have more nasal symptoms, congestion, runny nose, post-nasal drip, we may go more with like antihistamines that are oral. We may go with nasal inhaled steroids, and there's also different medications that may help to stabilize the kind of cells that mediate allergies. So we have multiple prongs we can use really to attack the symptoms of allergies and try to mediate them and kind of minimize the symptoms.
Okay, and really important too, I think, Doctor, is when should a parent consider it's time to take their child, their teen, to see the doctor? You know, not to just say, oh, well, they're just sneezing once in a while, but when is it time for a parent to bring the child in to get checked out by you?
Yeah, it's a good question in the sense that a lot of times we see these parents, these children come in, and it's not so much because they're thinking allergies, they keep thinking that they're having colds, they can't shake this cold. And sometimes that is the case, but so I think when you feel like your child is, you know, why can't they shake this cold? We see that a lot, but I think that if you're not sure, that's always a good reason to get checked by the doctor. But also when you're not really sure, especially in younger children, what medications can I even use? Because I know I can take certain medicines, but maybe I can't give that to my child. So it's really a good idea if you're not sure, especially in younger children, to make sure, number one, we're treating the right thing, and number two, that we can tailor the treatment to your child's symptoms as well as to what would be most effective based on what they have.